Okay. All right, so we're going to continue with the hormones. Yes, we talked about human growth hormone and its function. Now we're going to talk about prolactin. If you're for something, you're pro. So prolactin is for lactin. You're prolactin. This is so stupid. Yeah. Okay. Prolactin's released from the anterior pituitary in response, watch. You don't know, well, maybe you know this. During pregnancy, you have high levels of estrogen and high levels of progesterone, both of which are produced by the woman's ovaries. Yeah? So, high levels of estrogen and progesterone stimulate the anterior pituitary to release prolactin. This is kind of counterintuitive, but it's the way it works. High levels of estrogen and progesterone stimulate the release of prolactin, but high levels of estrogen and progesterone block prolactin receptors. Let me explain why. Prolactin, as the name implies, begins the production of milk in the breast. Okay? Prolactin, before lactin. So estrogen and progesterone are high when you are pregnant. So you want to begin to, the breasts become larger, they become engorged, right? And then when you pop out the fetus, there is a drop in estrogen and progesterone. Rapid drop in estrogen and progesterone. And they believe that's one of the things that causes like postpartum depression is the rapid drop in estrogen and progesterone, specifically estrogen. But the prolactin levels remain high. So with the drop in estrogen and progesterone, there's no longer blocking those prolactin receptors. And as a result, prolactin can do its job, and that is to begin the production of milk in the breast. A couple of other things prolactin does is it provides, it's the hormone that's released. So that's why women are pretty nice right after you're done. They're grateful. Who cares, right? I don't care. Leave me alone. Yeah, remember. Watch. Also, prolactin stimulates hunger. That's why people get hungry after they're done. Or they want to have a smoky smoke.
Is that also why it feels good to nurse your baby?
Yes. I wouldn't know about that. Okay, watch. Here's the other thing. Watch. These hormones, prolactin, remember, prolactin levels are very high during pregnancy. Prolactin can cross the placental membrane and enter the fetal circulation. That's why some little babies come out and they have like this kind of like whitish milk coming out. And that's called witch's milk. And it's a result of the baby being exposed to high prolactin as well. So it's no big deal. Any of your babies have that?
You know, my daughter had ovarian cysts, actually, and they thought that was because she was exposed to them.
Yep. That's what happens. And just so you know, we all start out as women. Right? That's why guys have breasts. So we all start out as women, and then as the hormones start kicking in, it will differentiate us into men or women. So if you gave a guy prolactin, he could make breast milk. And I think in this day and age, why not? You know, you take the day shift, I'll take the night shift. So that's prolactin. And again, it's kind of counterintuitive, but that's how it works. So make sure if you're going to answer that, you include that in your answer. Did we discuss going over the cortisol and thyroid hormone stuff again? And you said, no, we don't have to do that. Is that what you said?
Well, because we already had
Yeah,
one over those.
yeah. Do you want me to go over it again? Yes or no? Okay. These two, follicle stimulating hormone and luteinizing hormone, I'm going to go over when we talk about male and female reproduction. All right. I'm going to briefly go over thyroid hormone, yes? And again, this is where people kind of blew up on quiz number 2. I mean, it was a mess. It was a hot mess with no water. I mean, nothing. So, look, I'm going to talk to you about thyroid hormone. I had a dream about this last night. Thyroid hormone. That you guys didn't understand TSH. And you know how they say people, their dreams can't come true? This one did.
It's too early.
I know, right? Who takes an 8 o'clock class? I was praying so much they wouldn't give me this. Right? I'm not a morning person. I'm like a 10 to 10:15 person. That's all I got in me. Watch. Thyroid hormone. There's 2 basic forms, T4 and T3. Which is more metabolically active, T4 or T3? T3 is. And the primary function of thyroid hormone, its primary function, is to control your basal metabolic rate, BMR. How many calories you burn at rest. So if you are hyperthyroid, high levels of thyroid, then you will begin to burn more calories. And I'll explain how it controls BMR in a minute. The other thing that it does is that it increases protein synthesis in literally all cells. So I explained to you that people who are hyperthyroid, the protein connective tissue in the back of their eye thickens and causes their eyes to get pushed out. The other thing that it does is that it increases the development of the nervous system. And babies who are born hypothyroid, they are usually mentally retarded, and they're called cretins. That's cretinism. The other thing that thyroid hormone does, and this is important, is it makes epinephrine and norepinephrine, the hormones and neurotransmitters of the fight or flight response, make them more sensitive. So what happens to your heart rate and blood pressure when norepinephrine and epinephrine are around? Goes up. So even at rest, these people's heart rates are higher and their blood pressure is higher if they're hyperthyroid. And then the opposite is true too. All right? Okay, so here we go. All right, so you got your thyroid gland here. And then you have the anterior pituitary. In response to a drop in basal metabolic rate, come on, a drop in BMR, I'm going to shoot this thing in about a minute. The anterior pituitary releases the hormone thyroid stimulating hormone. Now, look, biologists and biochemists, they're not creative. Thyroid stimulating hormone does what it says. It stimulates the thyroid gland. Are you writing that down? So if we look with the ever popular straight lines on a circle, you have what are called follicular thyroid cells. And embedded on these follicular thyroid cells are, you're not going to believe it, but TSH receptors. So when TSH is released from the anterior pituitary in response to a drop in basal metabolic rate, it is going to bind with TSH receptors. The thing that it does, its most powerful effect, is embedded in the cell membrane of these follicular cells are iodine pumps. And iodine is required to make active T3 and T4. So the iodine pump will pump iodine in there, and you will begin the process of making T4. T4 has some biological activity, but not as strong as T3. So this is called thyroxine. That gets dumped into the blood, and then T4 goes to the liver. And T4 then gets converted to the major metabolically active form T3, or triiodothyronine. You like that? I don't know if I told you this, but I gave security guards dollars, and if you tell them triiodothyronine, they'll give you $1. And look, around the holidays, that could come in handy. That'll buy you half a tank of gas, or like 3 cigarettes. Who's following this? Got this? All right. T3, T4's major function is literally on every cell of your body, and its purpose, or what it does to control your basal metabolic rate, is it affects sodium and potassium leak channels. So T3 makes your cells more leaky to sodium and potassium. So if more potassium leaks out and more sodium leaks in, to maintain the concentration of sodium and potassium in the blood and cell, the sodium potassium pump, which is ATP dependent, has to work harder. So you got to pump those 3 sodiums out, more of them, and you got to pump the 2 potassiums back in, because the leak channels are more leaky. And because this is ATP dependent, you're going to be using more ATP than normal. So if you understand this, then you should be able to predict some of the signs and symptoms of hypothyroidism. Number 1, they will have, can you see that? Oh yeah. They'll have weight loss, right? Because what? If you eat a hamburger, you're not going to be storing that as fat, because you're going to be using the fat and glucose inside that hamburger to break down inside your cells to make ATP, to make the sodium potassium pump run. I said that in one breath. Did you follow that? And watch, when you break off that 3rd phosphate, one of the other things that you produce is heat. So one of the things that people who are hyperthyroid complain about is the intolerance to the heat. They can't stand the heat. So they get out of the kitchen. And they never go back. Just stay out. Also, if you recall, T3, thyroid hormone, that makes epinephrine and norepinephrine more sensitive, so that's going to increase their heart rate and increase their blood pressure. So they are referred to as hyperdynamic. Also, because you increase neural activity, they're going to have anxiety, and they're going to have insomnia. Did you follow that? Here's the thing, though. Here's the thing. Like, Watch, again, I'll just tell you this, and then I'll never say it again for another 10 minutes. What I'm trying to do for you is, if you understand how this stuff works, the function of this hormone, you can predict what's going to happen. If you don't, then you will spend the rest of your life trying to memorize this stuff. Say yes. Got that? All right. So that is thyroid hormone. Like that? No? Okay. So since we went over this before, I'm going to ask you a question. If somebody's TSH is elevated, are they hyper or hypothyroid? They're hypothyroid. And if their TSH is low, they are obviously hyperthyroid. Now, maybe you'll remember this many years from now, right? When you're old and gray and you're sitting in a rocker updating your Facebook status. Thyroid hormone makes norepinephrine and epinephrine more sensitive, right? So the amount of epinephrine and norepinephrine you usually have circulating, in the presence of high levels of thyroid hormone, it makes it more active. So their heart rate and blood pressure go up. So there's a condition called Graves' disease. Have you ever heard of it? It's very bad because it's grave. What happens here is that it's an autoimmune disease where antibodies, now we know a little bit about this, antibodies, instead of destroying TSH receptors, actually stimulate TSH receptors. So these people are dumping out tons and tons of thyroid hormone. So one of the things that can happen to them is they can go into ventricular fibrillation or have stroke out. So watch. What does epinephrine bind to? Get this right. Get it right. What'd you say? You're gonna. Everyone was gonna get 5 extra percentage points on their midterm, and you didn't wait. It's too late. Epinephrine binds to beta receptors. Very good. So if a person has Graves' disease, the first medication that they're put on are beta blockers. Again, top flight information, right? Because you don't want people to go into ventricular fibrillation or die when they got Graves' disease, or they'll end up in the graves. Yeah. Is ACTH and cortisol on there? Do I have to go over that one?
Cortisol is on here.
Do I have to go over it, yes or no?
Might as well. If you remember thyroid.
All right, real quick. You got 2 types of stress. Yep. You got acute and... That's right. Can you see that? That's a terrible color. I need good colors. All right. What about this? You like that? Oh, yeah. I'm staying with this. I'm never leaving this color. Acute and a chronic. Right? In acute stress, you get the release of epinephrine, norepinephrine, sympathetic. Chronic stress, you're going to get the release of chronic. You're going to get the release of cortisol. And cortisol is a steroid hormone because it has cholesterol as a base. And cortisol's 2 primary functions are as an anti-inflammatory and it is designed to raise your blood sugar. So if you focus on the metabolic aspects of cortisol, cortisol is primarily released during the night, and it actually peaks from about 4 to 6 a.m. So that's another one of those hormones, like growth hormone, that contribute to an elevated blood sugar in the morning. That's also referred to as the dawn effect. So cortisol, number one, it decreases the number and sensitivity of insulin receptors. So it essentially gives you type 2 diabetes. Number two, increases the breakdown of glycogen in the liver. Number three, there is increased breakdown of collagen, especially the skin. So that's why people with Cushing's get thin skin. And they use those amino acids that are in the protein of that collagen. They go to the liver and they're converted to glucose. Number four, there's a redistribution of fat. So they get the belly fat and the buffalo hump and the moon face. Now, watch. If you look here, watch it. You got your kidneys. And then you got your little adrenal gland that sits on top of the kidney. Watch. The outer portion of the adrenal gland is the cortex. And the adrenal cortex produces three hormones. It produces cortisol, aldosterone, and DHEA, the mother of all hormones. And high levels of DHEA will produce testosterone. Now, in people with Cushing's disease, where you have a tumor of the adrenal cortex, all three of these hormones are elevated. And if you recall from our study of the kidney, and I'm sure that most of you will never forget it, all of you, and including me, unfortunately, are going to have to die at some point. And I don't know why I have this feeling, but I do. That, you know how they have, like, at the funeral, they have like a little kind of a slideshow of the person's life. I have a feeling that one of the slides for your funeral will be the function of aldosterone. Can you imagine if it actually was? Let me tell you something. If any one of you were to actually do this, it would be pretty clear that your life really didn't turn out the way you wanted it to. Now, get this. Come on. Watch. Just one time. Just pay attention. In people with Cushing's disease, they get high levels of all three of those hormones. So they will have high levels of aldosterone as well. And the function of aldosterone is to stimulate the sodium-potassium pump in these renal tubules, and it will pump 3 sodiums back into the blood, so water will follow that. And then you'll pump 2 potassiums out into the collecting tubule. So that's why people with Cushing's disease, they have high blood pressure, because they're exposed to this high level of aldosterone. Yeah? that's pretty much the function of cortisol. Hold up. How is cortisol controlled? It's controlled through the pituitary gland. The pituitary gland is going to release adrenal corticotrophic hormone, so ACTH. Why isn't this working? This is really starting to irritate me. There. And ACTH is released in response to chronic stress. And as I explained to you, the brain perceives stress, and the hypothalamus and the pituitary are connected. So this allows the brain to stimulate the anterior pituitary to release ACTH. The result is you're going to get this rise in cortisol. So I've seen students over the years, especially when they get into clinical, they may have been in really good shape, but then as they go through clinical, they start developing a belly. Their face starts getting a little rounder. They get the buffalo hump. Yeah, and they're taking metformin because of the chronic stress. And then as soon as nursing school is over, boom, like they deflate the balloon. Yeah, face goes back to normal. Yeah. Right. So I'm expecting you, all of you, to see you a little tubbier. I had 4 students come to see me yesterday. They're going over cardiac stuff. They're in 3rd semester, right? And they go, Tim, you were right. They don't explain anything. They don't. And you know what they'll tell you if you go to them and ask for help? Well, it's in the book. That's their help. Right? Those people are going to make it. Yep. And they're going to make like $1 million, I think. I don't know. Okay, what's next? Cortisol. Did I do calcitonin and parathyroid hormone?
No.
Okay. You better, yeah. I should just make everybody learn those hormones. One of your questions should be the hormones. What do you think, Carl? Carl's pretty ambivalent. Anybody think that'd be a good idea? No? I know what you're doing. I know exactly what you guys are doing. You're playing the odds. There's 29 questions. What are the odds that I get that hormone question? Who cares? Whatever. There's more than one. And that's what you're doing. You're playing the odds. You're playing the odds you don't get that, or you don't get the hamburger question. And I'm here to tell you, karma is a witch. It is. It just comes back and boom. Not even playing. And then I don't know if I told this class, did I tell you that I was going to stack the deck? Like put like a bunch of hamburger questions and hormone?
So nice.
Do you think I'd actually take the time to do that?
Probably just to torture us. I think you would.
Hold up.
Don't forget all that right
I will not. Oh wait, I think I forgot the beginning.
If I
Oh.
cared that, but I,
No,
If I cared to,
no,
Ooh, that's good.
no. You're wrong. It is clear that Kira is young. What's a B for? Oh, because the class is subjective, and she sasses back.
Do not.
You know, you can make some really good words. You can make bitch there, ass. Look,
Sass.
sass. Yeah. Sassy.
Uh-huh.
Cassie. Yeah. Did I tell you I'm a starter, not a finisher? Did I tell you that? This class goes rapidly downhill right about this point. I mean, it goes in the tank quickly. All right. You guys got to get this. Oh, I haven't used this in a while. Got to pull this out. What's the goal of the body? Yep. Right. So one of the most important electrolytes you got to maintain is calcium. And calcium is controlled by two hormones. One is called calcitonin. And the other is called parathyroid hormone. Can you see that? Yeah, that ain't bad. All right. So what you guys need to do is you need to understand where can you get calcium from and where can you store it. All right? So let's talk about how you could increase your calcium levels. How could you do that? Come on. How could you increase your calcium levels? Come on, talk to Timmy. That's very good, Mary. You could eat calcium. Right? They have, at the Gateway Commons area in Kenosha, they have calcium sandwiches. You can just order some. You can have peanut butter and calcium. You can order a side of calcium. That is so stupid. God. Alright. Okay. What the? Okay, you can eat calcium. What's another thing you can do? Come on, Mary. Are you actually eating a calcium sandwich? You're really chomping down. You guys have like a little kitchenette back there? Watch. You can increase the removal of calcium from bone. Where do you store 98% of all your calcium? In bone, right? How do you get rid of calcium in the blood? What's one of the ways? Peeing. So you can increase the reabsorption of calcium by the kidney. Yes? So that's how you can increase your blood levels of calcium. How do you decrease your blood levels of calcium? Well, you eat less calcium. You prevent the removal of calcium from bone. Or you decrease the reabsorption of calcium by the kidney. Do you see where I'm going with this? Good. All right, so let's talk about it. Parathyroid hormone, as the name implies, is 4 little glands that circle the thyroid gland. They surround the thyroid gland. What does para mean? Around. Look. It's around. I'm going to keep going. That's the parathyroid gland. And then you have specialized cells embedded in the thyroid gland that will release the other hormone, calcitonin. So if you think about it, it's kind of calcitonin. That it's kind of the same thing as insulin and glucagon, right? One of these hormones is going to be released when the calcium's high. The other one's going to be released when the calcium is low. And none of the hormones will be released when calcium is just right. Okay, so here we go. Oh wait, that's a good word. Where is it? Goiter. Don't you like that word? If you say it on your final, I'll give you extra credit. Just come in and say, hey Tim, goiter. Watch. I'm going to explain to you when your calcium levels are low. If there is low calcium in the blood, that's called hypocalcemia. You're not going to believe this again. There are parathyroid hormone receptors. Oh, receptors. Can you believe that? On the parathyroid gland. So this is the parathyroid gland. The PT gland. And when there is low levels of calcium in the blood, that low level of calcium will stimulate parathyroid hormone receptors, and it will cause the release of parathyroid hormone into the blood. Again, watch. If your blood levels of calcium are low, what do you think parathyroid hormone's going to do? Just spitball here. Come on. What do you think? It's going to what? Yes, that's exactly right. I mean, go figure, right? Right, Carl? Yeah. I mean, look, who's going to argue with that, right? That makes complete sense. All right. Watch, you learn this in general, and don't lie to Timmy. I know different. There are two hormones that control bone building and bone breaking down. Watch it. You have osteoblasts. Osteoblasts build bone. Osteoclasts break down bone. What's bone made out of? Calcium and phosphorus. Hydroxyapatite. Remember that term? See? Because it's kind of weird, right? Yeah, what does appetite have to do with bones? Maybe it makes you want to eat more calcium. Really have those calcium sandwiches. You know what I was thinking? You know how they got that Boss sandwich? Right. At Pick and Save? I'm going to make a Boss sandwich out of calcium. The calcium Boss sandwich. Yep. Be a big seller. And I'll sell that along with ANP juice. Watch. Watch. Osteoblasts take calcium and phosphorus from the blood and build bone. Osteoclasts take the calcium and phosphorus that's in the bone, break it down, and liberate the calcium and phosphorus into the blood. Who's following this? You got that? Yeah or no? Guys? Did you follow that? Did you follow that? Osteoblasts build bone. So they take the calcium and phosphorus that's floating in the blood and build bone with it. So osteoblasts lower blood levels of calcium. Osteoclasts do the opposite. They take the calcium and phosphorus that was in the bone and break it down to calcium and phosphorus and liberate it into the blood. So osteoclasts raise blood levels of calcium. And just so you know, your bones are not static. What I mean by that is that there is constant calcium and phosphorus turnover. Every 10 years, you get a new skeleton. New calcium and phosphorus that makes up your skeleton 10 years from now is different calcium and phosphorus. Do you follow that? So there's constant turnover. So once you hit puberty, and for women up until about the age of 35 or so, including men, osteoblastic activity and osteoclastic activity are pretty much matched. That maintains the density of your bone. Hold up, we're not finished yet. Estrogen and testosterone. How you spell it? I got it. They stimulate osteoblasts to build bone. Watch it. What does a woman do at the age of 50? They go through menopause, so the ovary stops secreting estrogen. One of the strongest stimulators of osteoblasts is estrogen. So when a woman no longer produces estrogen, they don't have a strong stimulator of osteoblasts. So the osteoblasts don't build the bone, but the osteoclasts begin to break down the bone. That's why women have a greater incidence of osteoporosis than men. Men secrete testosterone to the day they die. And before class, I went into the bathroom. I was thinking about that. So I just gave myself a high five in the mirror. All right, Tim. Yeah. Oh, did I? But I was doing that. I'm like, hey, I still got testosterone. So did I go over this already, the osteoblasts and stuff? Did I go over parathyroid hormone and calcitonin? Oh, growth hormone, yeah. Okay. So, and I explained to you, watch, you're not going to believe this. Have you heard of a drug called Fosamax or Boniva? Have you heard of those? You've never, hi, I'm Sally Fields and I take Boniva. My bones are rotting off and I took it and now I'm good. And I can fly now. You never saw those commercials? So watch. What those drugs do is they don't stimulate osteoblasts, they just inhibit osteoclasts. So it doesn't build bone, it just prevents the bone from thinning more rapidly. Yeah or no? Alright. So watch. Why was parathyroid hormone released? Come on. Why? Look back. I'm not telling you. What? Low levels of calcium in the blood. So what do you think parathyroid hormone's going to do? Right. You didn't even have to say that. I understood that when she went like that. What takes calcium out of the bone and puts it into the blood? That's nice. So what do you think parathyroid hormone is going to do to osteoclasts? See? Do you see this? So parathyroid hormone stimulates osteoclasts and inhibits osteoblasts. So it will cause the bone to be broken down to calcium and phosphorus, liberate that calcium in the blood, and raise your blood levels of calcium. Say yes. Okay, wait. You're not going to believe this. Here we go. Oh, that kidney. That thing's never leaving you. You know what I'm going to do? Every time we have class until the end of the semester, I'm going to make this picture of the nephron bigger. So it actually looks like it's coming after you. It's going to get you. Hey, do you guys know the stages of grief? Do you know them? Like there's anger, right? Denial, and then compromise, and then acceptance, right? I hit the acceptance phase. It is what it is. So here we go. Watch. I'm really struggling today. This better be included in your answer. Mary, you're going to get this question. And just know it. Parathyroid hormone affects the distal convoluted tubules and causes more calcium that was going to get peed into the toilet to be reabsorbed into the blood. Again, that makes sense. Mary was the one who brought it up, so I think it's only fair that Mary finishes it. Mary, are you going to finish it? You told me that one of the ways to increase the blood levels of calcium is to eat more calcium, right? You were exactly right. But what do you need to absorb calcium from the gut that's made by the kidney? It starts with a V. And an I. And a T. And an A. Vitamin D. Parathyroid hormone stimulates the kidney to produce more vitamin D. That's why if you look, who drinks milk here? Anybody? You do? Good. What do you want from me? So you drink milk. Big wow. But that's why on milk cartons it'll say milk and it's fortified with vitamin D. That vitamin D will allow you to absorb more calcium from that milk. That's why they do it. So parathyroid hormone stimulates the liver or the kidney's production of vitamin D so you can absorb more calcium from the gut. So that's the function of parathyroid hormone. Did I tell you this story? Did I tell you this story about parathyroid hormone? Well, once upon a time, I probably didn't. Can I tell it to you just real quick? This company I work at on Friday, I'm in the lunchroom and I'm talking to this lady. She's about 50 years old, right? And she goes, Tim, I'm really having a hard time swallowing. I go, what are your other symptoms? You got anything else? And she goes, yeah, it feels like my heart is pounding out of my chest. And I said, are you able to sleep? She goes, I am just like dead tired all the time. I can't concentrate. I'm getting written up at work. So I take her pulse, right? And her pulse is like 42. Then I take her blood pressure, and her blood pressure is like 230 over 120. And I go, you need to go to the emergency room right now. You have a parathyroid tumor. And she goes, how do you know? Technical college. I said, this is an emergency. You have to go. So I actually called the ambulance. They ambulated her. Get it? To the hospital. And then I don't see her for a couple of weeks. And sure enough, she had a parathyroid tumor. How did Timmy know that? I got degrees, sister. When we get to the nervous system, I'm going to talk to you about elevated calcium levels and their effect on the nervous system and the heart. You got me? And if you get this, you'll be able to make complete sense out of this stuff. If you don't, I don't even know what to say. Okay, so here we go. So that's parathyroid hormone. What's the opposite of parathyroid hormone? Come on, just say it. What is it? Yeah. Don't you think calcitonin is kind of a cool word? That wouldn't be a bad name for a kid. Hey, calcitonin. Drink your milk. All right, so here we go. Are you ready? When your blood levels of calcium are elevated, there are specialized cells embedded in the thyroid gland called follicular cells of thyroid. So if your blood levels of calcium are elevated, that is going to stimulate calcitonin receptors and cause the release of calcitonin into the blood. Now again, your blood levels of calcium are elevated. So what do you think calcitonin is going to do? I don't know. What builds bone? What takes the calcium phosphorus from the blood and puts it into bone, lowering your blood levels of calcium? Osteoblast. So what do you think calcitonin is going to do to osteoblasts? Calcitonin stimulates osteoblasts. Why was calcitonin released? Your blood level of calcium was elevated. So by stimulating osteoblasts, they will take the calcium and phosphorus from the blood and deposit it on the bone. Calcitonin also inhibits osteoclasts. You don't want to be dumping more calcium into the blood by breaking down bone. Wouldn't make sense. What do you think calcitonin is going to do to vitamin D in the kidney? What do you think? What do you think? Come on, what do you think? Hey, Mary, pinch it real hard, okay? What? Calcitonin decreases vitamin D production. If your potassium or your calcium levels are high, do you want more vitamin D to absorb more calcium from the gut? Of course not. And what do you think calcitonin does to calcium that in the kidneys? Do you want to reabsorb calcium back into the blood when your calcium level is high? No. So calcitonin increases the amount of calcium lost in the urine. Say yes. How many people followed that for real? Did you? You didn't. That's calcitonin. Calcitonin, they used to think it could be used as a drug for treating osteoporosis, but it had other untoward side effects. So they abandoned it on April 18th, 1981. I'll never forget it. Big headlines. That's calcitonin, parathyroid hormone. What else? Did I cover the hormones? Except for follicle stimulating hormone and luteinizing hormone, right? Okay, I'll cover that when we talk about reproduction. Oxytocin?
Yeah.
Okay, I'll go over oxytocin. What's that? Did we do oxytocin? We did it when? Tuesday? We did oxytocin on Tuesday. Oh, we did. What do you mean, no?
She would have no down. All we did was growth hormone and we were doing blood gases all class.
Oh, really?
Yeah.
I don't even remember that day. All right, well, let me go over it. That way I can feel good about myself, okay? Here we go. Take.
I mean, all you said about it was that it was produced by the hypothalamus but released from the anterior and posterior pituitary.
That's right. You're right. And now I'm going to tell you more. Here's a little kid. He looks all comfy and cozy, don't he? Look, he's in the fetal position. Do you know why? He's a fetus. Here we go. The cervix has nerves. They're called baroreceptors. What do baroreceptors recept? There. They recept pressure, weight. So when little Egbert's head comes down the birthing canal and it hits the cervix, that's going to increase the pressure in the cervix. And that's going to stimulate baroreceptors. Those baroreceptors, those nerves, then travel via afferent fibers to the hypothalamus. When the hypothalamus is stimulated, it will begin the production of oxytocin. So remember, the hormones that are produced by the hypothalamus then get stored in the posterior pituitary via the neurophoresis and the portal circulation present in the pituitary gland. That sounded really good. Okay, so watch. So now the kid's head's bumping up and down on your cervix, and then the posterior pituitary is going to release into the blood the hormone oxytocin. Again, this is kind of a positive feedback mechanism, right? You want to increase the force, duration, and frequency of your uterine contractions, and that's exactly what it does. So oxytocin makes the uterus contract harder, more frequently, and longer. And then Egbert pops out, right? They clean off his nostrils, right? Wipe them off, and then swaddle them and put them in mommy's arms, right? Oxytocin then also stimulates the letdown of milk into the alveolar ducts of the mammary gland. So you pop the kid out, now you got to feed them until they're 18. So 18 years of feeding that kid. So the other thing that oxytocin does is that it increases mom and child emotional bonding. So that's why they don't like to wait to put that baby in the mother's arms. They want to get the kid out, do a little app score, suck out his boogies, right? Put a little silver nitrate in their eyes, wrap them up, and boom, there. And what they're also doing is they're giving fathers oxytocin nasally so that the father will begin to bond with the child. And they're also using oxytocin as that social aversion. People who don't like to be in public, right? Deal with a lot of people, like myself. I'm actually on oxytocin.
So it's not working.
No, clearly, right. So they're going to increase my dose. I can feel my uterus growing, contracting. I thought I was constipated. So that's oxytocin. Say yeah. You got that. Yeah, you got to have that milk. Did I tell you I was at a Yugoslavian picnic with buddy's Yugoslavian? We're sitting at a picnic table, I'm talking to him and this woman, right? And this like 4 or 6 year old kid just comes, grabs the ma's boobie, and just starts going to town on that thing. I'm like, okay. I felt like saying to her, you should put those posts there and make a line. $1. Okay. Only smart ones. Okay. What's next?
Can you go over thyroid stimulating hormone?
Thyroid stimulating hormone is released from the anterior pituitary in response to a drop in basal metabolic rate. Also, it's long exposure to cold, right? If you're out in the cold for a long period of time, that's going to cause TSH to be released because your thyroid hormone produces heat. That's why this is true. People who freeze to death, they freeze
Long
to death.
exposure to cold.
When they find them partially clothed. Because right before a person freezes to death, the thyroid hormone, you get this massive release of thyroid hormone to try to generate body heat, and they actually overheat their body, and then they start taking off their clothes because they're overheated, and then they ultimately freeze to death. That's a fact. So don't do that. Don't go out in the cold. Stay in a nice warm house and read the book. That's the hormones there, yes? Did we do good? All right, do me a favor. Take a break. Oh, wait, and before you go on break, this is what I'm going to do. I'm going to give you the blood gas of the day. If you get this right, there's extra credit for you on the final.
You being serious?
Yeah,
How much?
I'll let you know. I'll give you something, right?
Yeah, these are
I know, right?
Ready? The blood gas of the day. You know what I should do is that's what I should do. I should give security guards the answers to blood gases, and then give you the blood gas, and then you'd have to go and tell them. And if you tell them, then they'll give you some money. What do you think of that? Well, pH. There we go. What are you taking a picture of? Oh, you're not going to work on it now, huh? Oh, I know what you guys are going to do. I know what you guys are going to do. You're going to go online, Google blood gas calculator. Oh. Come on. Who's going to get this? You know this shirt I got a green one like this. It's rubbery. Like this. Look, it's like it's like rubber. Well, clearly not. But it's really kind of got a weird material. Okay, who wants to do it? Oh, okay. Well, you guys are so very excited. All right, go ahead. Well, that's exactly right. But now you have to explain why. Yeah. Go ahead. No, you want to do it, Mary?
Yeah.
Oh, okay.
So the pH is low, so it's acidic, and
Yeah.
then the oxygen and O2 stat is low, so they need oxygen. And PCO2 is high, so and bicarbonate is high too, so they're trying to raise the pH, but it's still low, so it's not there yet, so it's partially.
So why does a high PCO2 make it respiratory acidosis?
Because carbon dioxide is an acid. And
Yeah,
it's
she said that
causing-
very confidently. Did you notice that? She even had the kind of head bob too. Yeah. And what does the kidney do if they know it's going to help out? What does it do? So if the kidneys are helping out, your bicarbonate level is going to be higher than normal. And because the pH is still acidic, they're not helping out completely. That's what makes it a partially compensated respiratory acid. How many people followed that? That's good. Okay, go ahead, take a break. Just so you know, I put the RH factor, blood type. I made a video specifically about that. I put the blood clotting stuff online and the Coumadin and heparin thing for you. Yeah?
But that's all just to just one question, or?
Yeah, the blood clotting stuff. And then there's some, I got the individual hormones on there too. I got parathyroid and calcitonin videos I put together. Yeah?
You did all this yesterday?
No, I had those before. I just forgot about them. So I went back into the archives of YouTube. And got 'em.
You have a lot of videos on YouTube.
Yeah, because I try to help you guys. Yeah. And you know how I'm paid back? How am I paid back?
Sassiness?
And yeah, and students not studying.
That's not me.
Oh, really?
Not really.
What are those Pringles? Are those pizza Pringles?
Mm-hmm.
Those are, wait, don't tell me. Those are the cheesy ones. When I was in 6th grade, I had a paper route. And every day for lunch, I had a can of Pringles, an 8-pack of Hostess chocolate donuts, and a bag of Snaps. You know what Snaps are? The little licorice things. And that's what I ate for lunch every day. I'm probably going to die. Has registration started yet? I have to see if I can get that.
What are you teaching us?
Well, I'm teaching ANP, if you can call it teaching. Did you look at the digestive video?
Never opened it. It'll reopen it Thursday. Thursday next week. Yeah. February playground. Took that long? Mm-hmm. So my doctor really got into that. Oh yeah, I'm gonna get into it. Mm-hmm. You're a specialist. So but you know how they do it. You're special. Did you already call this morning? See what time it was at? I already know what time it was at. They called me when I was going to the bathroom. Yeah.
They got these classes set up really weird. Did you see the way they're scheduled?
I'm not complaining about my schedule. It's fair as long as it doesn't change.
What classes are you taking? Have you already taken microbiology?
We're in it right now.
Oh, you got Richard McLaughlin.
Mm-hmm. We're taking diversity and patho. Shall be fun. You only have to put 21 days.
Richard McLaughlin's a badass. He is. He graduated from McGill University. That's like the Harvard of Canada. Like,
Oh, really?
yeah, they don't accept people like me.
You can tell him. I thought he said that before. He says from somewhere else. No. He cracks me up sometimes. He always tells us to tell you
When did registration start?
Today.
Oh, it did.
Yeah.
Penny, I heard your patho class is the hardest class to take at Gateway.
The patho class?
Yours. First one.
Who said that?
A lot of people. Me and Mary were gonna take it, but you didn't even have it. And everyone was like, that's a bad idea, cause that's the hardest class to take.
I mean, I think it looks nice.
You only teach it in the summer.
Construction paper and
You guys think
That's
this
probably why
class
it's so
is...
hard, because it's summer and most people don't study in the summer as much as they do during the spring and fall.
This class ain't hard. It just requires a lot of work. It's not.
I don't study as much in the summer.
And you shouldn't be taking pathophys anyways right now. You should be taking it between your second and third semester.
Why?
Because then you get to review all that stuff, like all the ANP stuff. Because you go into health alterations. They're laying some heavy duty stuff on these students. I'm like, wow. Like all these heart, all these heart conditions. You know, then you have pediatric heart conditions, and because they don't understand the circulation of blood through the heart, the fetus, they don't get it. These people are struggling. They are. The couple of students that were there that took my class, they're doing okay, but they're still busting their hump. The other ones, it's over. They're done.
Do you think we'll do okay with taking John?
Oh, with pathophys? Yeah.
You said you helped him put the class together.
Yeah, you'll see all my stuff on there.
Yeah, he has a whole bunch of videos on YouTube too. Cool. Okay.
So yeah, it's not that bad.
And what's
People
your
aren't
rate?
used to
What's
working
your
that
best
hard,
one?
though.
He has one rate.
So I had a couple of students who took it last summer, and they took the patho, and then they were doing this health alterations class, and they're like, we got to drop this. We didn't realize this was going to be that much work. I'm like, how could it not be? Like,
Should I get that in my blackout for Christmas season? Oh my god.
it's supposed to snow this weekend. Like, it's supposed to be really rough out. Is that it? It's supposed to be really bad out.
Are you serious?
Yeah,
I
that's
heard
what
it
they
was just
said,
supposed to
right?
get cold.
Just cold.
I never heard nothing about snow.
It was supposed to snow, but not snow.
I want it to stay warm forever.
State.
In Colorado,
Yeah.
it's 80 right now. Yeah. Usually they're hit with snow by now.
If I get to retire, I want to be a golf ranger. You know, hey, you're playing too slow. Hey, fix your divot.
I
Right?
could never play golf.
And if they're playing slow, then I just drive by with a club in my hand and just whap them right on the side of the head. Damn. Give them a subdural hematoma.
That would work.
Okay, the way I got it figured, after today, we got 5 classes left.
Is
Yeah.
that counting the final or not counting the final?
I'm not counting the final.
So then we have 6. So next
Because that day, when you come in, I kind of do what you guys do. Like, you pick your questions, and then you'll start answering, and I'll go. Using my phone. And that's what I got to do, though. I got to have a hidden camera in here, and then show you what I look at, right? That's why you know what's nice is doing those videos, because like I'm not looking at anybody and I just do it. Do you know what I mean? So I got to do those videos, and I'm gonna put them, and I'm trying to get this class online.
That's gonna be rough.
I don't
Yeah.
care.
I care.
You know why?
Well, it would, but it wouldn't be because like they would just have to listen to the videos like twice. They'd be here in class and then listen to it at home. And then just listen to it like a 3-hour video.
really stink. I don't want that.
I just don't know how I feel about online classes. Yeah. Like midterm.
You know what? Online classes are designed for people who have a proven track record of academic success. Like, you're going to get your graduate degree, right? You know how to learn. You know how to do this stuff. You know what I mean?
I feel like I don't learn much. Like midterm, we did online.
I think,
it was a joke.
you know what they're telling me the nursing instructors are doing? They're doing what they call flipped classes.
Yeah.
They put the stuff online, you learn it, and then you come into class and then you discuss what you don't understand.
That would be nice.
Whatever happened to, and then what they do is they put these PowerPoints, and the talk online is they read you the PowerPoint.
Well, that's valid. I mean, that would be the issue right there. Because
You can read.
right. What I'm saying is, a lot of the PowerPoints are helpful, and so is the textbook, but it's nice having somebody to. Right. So, but you need a blend of that. Because I
Right.
think online classes are pretty amazing. I gotta say.
Oh yeah, but here's the thing. Again, people who are motivated, they're gonna do online classes because it works with their schedule, right? But they're motivated to learn. Those who aren't motivated, it's like you take an online class, forget about it. Forget about it. It's over. Even in class, it's like I don't even know what to say. All right, here we go, guys. Okay, can you guess what I'm gonna do this weekend? Any idea?
Golf.
And eat box stuff.
Yeah.
Eat box stuff?
Corn
Box
turkey.
stuffing.
Oh, no.
Well, you're definitely gonna golf on Sunday.
If the weather's good, I'm golfing. Definitely. Absolutely.
Saturday's supposed to be 67.
Sunday's 40. What?
Sunday, yeah. Okay, well, I'm golfing Saturday then.
No, Saturday's 42. But tomorrow it's gonna be 68.
Oh, I gotta work.
Oh, yeah.
Maybe I
Call
don't.
in.
Yeah, I'm gonna call in well. I feel too good to come in today.
Just be honest.
Yeah. Right? Don't lie. Don't come up with that fake cough. I'm on deathbed. You know what the hardest part of the day is? Dragging your fatty acid out of bed. Once you get out of bed, you're okay. Getting out of bed, though, that's the tough part. Especially in the wintertime, too. You know, when it's really cold, you know, and you got that nice little warm blanket. Then you get out, and I got hardwood floors in my house, and it's like you hit, then you sit on that toilet seat, and it's like really, really cold. The nicest thing that we ever got from our mom was a heated toilet seat. That thing is like, it's like going to like a salon. They treat you really nice. You know what I mean? It's like, wow, that is really good. All right. Okay, here we go. We're going over the nervous system. Right. Did you went over the nervous system in general, yes? What did you go over in general? 15 weeks. Huh? Well,
I'm the only one that says these things. But I didn't learn anything in general.
how could you learn something that's
Yeah,
ridiculous?
maybe a few tiny things.
We learned location. It was like not anatomy and physiology, it was just anatomy.
Okay, well this is anatomy and physiology. I'm gonna tell you where it is. I'm gonna tell you what it does. All right, your liver's right here. Okay, here we go. You ready? We're going over the nervous system. No longer, after this class, can you say to someone, "You're getting on my nerves," right? Irritation is sensed in the central nervous system. So from now on, you will say, you're getting on my central nervous system. And in particular, the limbic system. That's the seat of our emotion. So you're really getting on my limbic system. Start using this stuff on a daily basis as it applies. All right, here we go. I do want to go over some of the actual critical anatomy of the nervous system, and I'll explain why in a little bit. The central nervous system, brain, and spinal cord, right? Answer this question for a couple of whiffs off this blue Expo marker. Yeah, we'll pass it around. Everybody gets it. True or false? The spinal cord does not do any neural interpretation. It is simply a relay station. True or false?
I'm gonna say false.
What was the question again? Oh, all it is a relay for input to the brain and then motor function to the body parts. True or false?
I said true, she said
Are you going to fight about it?
no.
Okay.
Just wanted the answer.
Well, I'm going to tell you right now. It's false. The spinal cord does do some rudimentary interpretation of neural stimuli. It processes, watch it, reflexes. What does a reflex do? Do you have to think about reflexes? No, it's reflexive. Right? Watch, if you put your hand on a hot stove, you leave it there for a little bit, then you smell the flesh burning, you're going to pull it away. That's reflexive. And only later do you feel that pain. True or false? True or false? If you are a paraplegic, below the site of injury, you have no reflexes. True or false? It's false. You do have reflexes. As a matter of fact, listen up because this is true. Post-spinal cord injury, several months into it, you are actually hyper-reflexive. If you do the knee tendon reflex on a person who's a paraplegic, that leg goes flying. Bam! They have actually offered some paraplegics contracts to be field goal kickers in the NFL. They just smashed that thing. Bam! So one of the guys takes.
You're terrible.
That's so stupid. Really? No, it isn't. Look. Okay, so watch. You're gonna learn this. You're gonna get this. Post spinal cord injury. Immediately after and a few days after that, there is no reflexes at all. Those reflexes only return after the swelling and damage to the spinal cord starts to reduce. And when you get into clinical, you're going to learn about this. You're going to learn about neurogenic and spinal shock. I'm going to explain to you neurogenic shock. Do you know why I'm going to explain that to you? Because I'm cool like that. All right, here we go. Central nervous system, brain, spinal cord. Watch it. Coming off the spinal cord are 31 pairs of spinal nerves. And each spinal nerve has two roots. You better know them. What are they? Ventral and dorsal root. I'll explain more later. Got me? They're pairs of spinal nerves because you have two sides to your body. Are you writing that one down? And watch, each spinal nerve innervates a particular area of the skin. A spinal nerve and the skin that it innervates is called what? Lindsay, get this right. $1 million and some tape. It's called a dermatome. Have you ever heard of that? Have you ever heard of dermatome? You've never heard? Yeah, you have. Just no one said it to you, like on the street or something. Do you know what shingles are? Did I explain to you shingles? Can I explain it to you again real quick? It relates to spinal nerves. When you have a mild case of the chickenpox, sometimes that herpes zoster virus is not completely destroyed. Basically what it is held in jail by your immune system. The jail for herpes zoster virus are spinal nerves. They lie dormant in spinal nerves. When your immune system is compromised due to stress, like being in this class, for example, that herpes zoster virus can begin to rear its ugly head. And because it's in spinal nerves, it produces that blistering in a specific dermatome of the skin. That's shingles. So are you going to get the shingles vaccine?
Do you know why people get it like over and over again?
Yes. Because their immune system response wasn't strong enough, so once they start feeling better, they can put it back in check. But if they're stressed out again and the immune system is compromised, it will rear its ugly head again. And if you have an episode, that increases the likelihood that you will have more episodes of shingles.
My cousin, she's only like 30 and she's already had it like 3 times.
Yeah, that's not right. Is she on like immunosuppressive drugs like steroids and stuff like that or no?
She just had a baby like a couple months ago, but
Yeah, having a baby's stressful. Yeah.
she's already had it like 3 times now.
The best part of kids is making them. I told you that, right? No? All right. You keep believing that. I love parents who go, I love spending every minute with my kid. Love it. Can't get enough of it. And I look at him and go, you're a liar. You're a liar. I said, my kid, I only got one of them, irritates me sometimes. I wish I had a little thing where I could just click and he would just go away for an hour and then come back and it was as if nothing was wrong. Right? And I tell him that's where I came up with that line. You're getting on my central nervous system. Yeah. You know what the worst part of it is? Is that I see so much of me in him. And not the good stuff. You know? He's just, ugh. And they watch what you do, not what you say. My kid takes off his shoes exactly the same way I do. We came in from golfing, right? So we go into the back door, come into the back hallway by the kitchen, right? And I go like this. And then he comes right in behind me. Okay. Reggie? You're with me. You're following this so far. Okay. The 31 pairs of spinal nerves are divided into 2 divisions. What are they? I'm waiting. No. 2 divisions of the peripheral nervous system. Get this right. Get it right. And I will give you Randy's kidney quiz. So I don't have to grade it. Come on, what is it? See, let me tell you. I set up this trap perfectly. It was designed to trap you. I said the 2 divisions of the peripheral nervous system, right? And then you saw sympathetic and parasympathetic. Didn't you, Carl? See? That's right. I trapped you. Look at that, one big slide for the freaking medulla. And look at how small it is. That's a waste of a slide. I never do that though.
You wasted all those thought on that thing with the sass and the ass and the bitch.
Ready? The two divisions, you better write this down. You're going to find this nowhere in the world. I'm the only one that knows it. And then when I see you Christmas shopping on Black Friday, we're going to walk by each other as we're pushing and shoving people out of the way to get that big screen TV. And we're not going to say anything. We're just going to go. The peripheral nervous system is divided into the somatic and the autonomic. What does somat mean? How many people have taken medical terminology here? That's like the best class ever if it's taught right. It is. Somat means body. I'll simplify even more because that's what I do. Do. The somat controls skeletal muscle. So are you under control of your skeletal muscle? Can control that. You are. You guys. Wow. The autonomic nervous system is divided into two parts. And this is where Carl comes in. The sympathetic and the parasympathetic. Got me? See, we will now return to that slide. And it's really important that you get this. The sympathetic nervous system comes off the middle of your spinal cord. The spinal nerves that make up your sympathetic nervous system come off the middle of your spinal cord. The parasympathetic, again, parathyroid gland, that originates at the top and bottom of your spinal cord. So it's around the sympathetic. Do you get that? Uh-huh. Sympathetic and parasympathetic. Now watch. You learned in general, you had to learn this. A ganglion is a group of nerves that are kind of locked together. That's a ganglion. You ever hear of a ganglion cyst? If you ever get one of those, that's a group of nerves that kind of ruptured through the sheath and now kind of protrudes around your wrist. And all you do is take a Bible or your textbook, but you don't want to do that because you want to maintain its pristine condition and then just smash it down. That's how they treat ganglion cysts. All right, watch. Get this. When the sympathetic nervous system exits the spinal cord, when it exits, it forms a ganglion or a group of nerves, and these nerves are all connected. And there are divisions of the sympathetic nervous system called plexus. So you have this area right here called the solar plexus. Have you ever heard, so you got hit in the solar plexus? You ever hear that, Carl? Yeah. So if you hit somebody in the solar plexus, it partially or temporarily paralyzes their diaphragm. That's why that's getting the wind knocked out of you. I know, it does. But you're like, can't breathe. And you can't even say you can't breathe because you can't breathe. So if you do that to somebody, then what you could do, I'm just saying, is take some of these towels, put them down their throat, then pinch their nose. What's that?
I have a funny phone number and I get calls all day from all across the world.
You should answer them.
Oh, I do, and I hang up.
And then you should say, hey, do you know where the solar plexus is? Are you with me, guys? All right, so watch. The parasympathetic around the sympathetic, rest and digest, right? Digested, that's where it's down at the bottom, and eaten. Num, 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 num. Boom. Got it? All right, you better get this. It's better be included in your answer somewhere. I don't even care if you don't even get the question. Just say, Tim, the parasympathetic nervous system releases acetylcholine. That's the neurotransmitter. And then the sympathetic nervous system releases norepinephrine as its neurotransmitter. So if a nerve releases acetylcholine, it's referred to as cholinergic. And if it releases norepinephrine, it's released or said to be adrenergic. Say yes. Got that? All right. Watch. Write this down. The nervous system controls the minute to minute, second to second changes that occur in your body to maintain homeostasis. So it acts quickly, but its effects go away quickly. And as you can see, and we've talked about before, that in the sympathetic nervous system directly innervates the adrenal medulla, and that will cause the release of the hormone epinephrine. So hormones take longer to act, but they act longer. So epinephrine, the hormone of the sympathetic nervous system, amplifies the effects of the sympathetic nervous system. All right, and as we can see, and I'm going to go through this very, very rapidly because we've done this before. The sympathetic nervous system and the parasympathetic nervous system work like an old man drives a car, right? They never take their foot off the brake and they never take their foot off the accelerator, right? If they want to go faster, they still keep their foot on the brake, they just push down on the gas. So what that means is this. You always have some sympathetic stimulation and you always have some parasympathetic stimulation. When you are scared, you simply have more sympathetic stimulation. And when you're resting and digesting, you simply have more parasympathetic stimulation. But there's always a little of both. Now, with that in mind, watch. If you're an old man and you're driving your car and you got your foot on the brake and the gas, how could you make the car go faster? What's that? Take your foot off the brake, right? So some of the ways that you can stimulate the sympathetic nervous system is simply by blocking the parasympathetic nervous system. So many of the drugs out there that are used to mimic the sympathetic nervous system, all they do is block the parasympathetic nervous system. Have you ever heard of a drug called atropine? Have you heard of it? Atropine is a parasympathetic inhibitor. So what's going to happen to your heart rate, blood pressure, sweating, blood sugar if you take atropine? They're going to go up. So, because you have unopposed sympathetic stimulation. Say yes, guys. Come on. Are you getting this? All right, I'm just going to keep going. I'm not going to look. Hey, when you draw people's blood, too, they're always going to say, I don't like getting my blood drawn. I'm not going to look. And I go, I'm not going to look either. Okay. Your pupils dilate. Why do your pupils dilate? I'll just tell you. I'm going to go through this because we went through this before. Your pupils dilate so you can get more light in. Decrease production of saliva. You don't need to digest food when you're running or fighting for your life. Increase heart rate and blood pressure, preparing your cardiovascular system to run or fight. Massive arterial vasoconstriction. Where? Everywhere. Right? Dilating the bronchioles so you can get more air in and out. You don't need your GI tract, so you inhibit peristalsis and GI activity. That's why people in the hospital get constipated. You increase the blood sugar due to the effects of cortisol, sympathetic nervous system, and epinephrine, and that increases the blood sugar because you break down glycogen. Epinephrine levels, norepinephrine levels go up, the inhibition of the bladder, and increasing the clotting mechanism. Your blood clots faster when you are scared, and that makes sense because when are you more likely to get cut? When you're scared. If you're sleeping, are you going to get cut? No. You ever got cut when you were sleeping? Right, you can't think of anything like that. It's ridiculous. Why would you have like sharp edges on your bed that could cut you? That's ridiculous. Write that down. Boom. That's the effects of the sympathetic nervous system. Oh, that's right. Okay, what I want to do now is I want to talk to you a little bit about the anatomy of the nervous system. People don't get this, so I'm going to make sure you get it. We have another star gracing the ANP class. All right, this is, what's her name? No, this is, she played on Will and Grace. Deborah Messing, that's it. Doesn't that look like Deborah Messing? There you have it. So another star shows up on ANP. Let's list them. We had Glenn Close in respiratory, Tiger Woods with pneumonia, Kenny in the urinary system, and then we got Deborah Messing with her brain hanging out. Nice. Okay, here we go. Watch. The brain and spinal cord float in the brain and spinal cord. They float in the skull and in the vertebral column. And what they float in is cerebral spinal fluid. If it wasn't for the fact that you had cerebral spinal fluid, your brain would get smushed under its own weight. So have you ever put anything in water and then you're able to lift it up, but then when you pull it out of the water, like, damn, that thing's heavy. That's because water provides buoyancy. So it provides buoyancy for your brain and for your spinal cord. So it reduces the weight of the brain in the skull by a factor of about 1/10. If it wasn't for cerebral spinal fluid, you'd be walking around like this. Because your brain would be so heavy.
How much does it weigh?
I don't know. I think it weighs like a little over 3 to 4 pounds.
So we have bigger necks then.
Yeah, for people who have bigger brains, they have really thick necks. Yeah. I met this really smart girl, right? I'm not even kidding. She literally had no neck. Her head was actually put right on her shoulders because she was so smart. Yeah. And then I'd ask her a question, and she would know, and she'd go,
Your laugh kills me.
it's so stupid. Watch. You're going to get this because I'm going to explain to you why clinically it's important and why people don't understand this, and that's why they end up holding a sign on the street, "We'll work for food." Watch. Remember I told you that every organ has a thin saran wrap that covers it directly? Then there's space, and then there's a thicker, tougher lining that covers the inside of the body cavity. Do you remember I told you that? Remember the pleural parietal and visceral. Remember that, Mary? There you have it. Well, the brain is no different. But the brain and its environment have to be tightly controlled, because we also learned in quiz number 1 that the central nervous system has no lymphatic system. So it essentially has no immune system. That's why the environment of the brain has to be tightly controlled. And it is even more protected than other parts of your body. And what protects the brain and spinal cord are called the meninges. The meninges protect the brain and spinal cord, and they provide a location for the circulation of cerebral spinal fluid, or CSF. I'll go into that more about that later. Now watch. The brain and spinal cord layers, protective layers from inside to out, begin with the pia mater. Pia mater, delicate mother. Delicate mother. So the pia mater covers the brain and spinal cord directly. You better get this. Here it appears that you're not paying attention. Yeah, and here's the thing. That's not a good place to sit if you're not going to pay attention, because watch, I can just look at you and say, yeah, you're not paying attention. I'm just playing. Okay, watch. I want this. Suspended above the pia by these protein filaments is the next protective layer, called the arachnoid mater. And the reason it's called the arachnoid mater is these little protein girders that suspended above the pia under a microscope look like a spider's web. Arachnoid. Nothing? Who cares? Watch. What's really important, what I really want you to know, is that below the arachnoid mater is a space, and you're not going to believe it. It's called the subarachnoid space. Oh, and that's where cerebral spinal fluid circulates. And then you have the tough dura mater. Durable, Duracell, dur. Oh. So this is thicker, and the dura mater lines the skull and the vertebral column. All right. Now watch. This is even more important. You got to get this. If we take again a closer look at Deborah Messing, what we will see is this. Now get this. You have the dura here. You got me? Now, guys, get this. Here's the dura layer. It lines the inside of the skull. Now watch. In the front part of the brain, top part of the brain, all the way down to the back, not including the cerebellum, the dural layer folds on itself. It makes a little pita pocket, right? So there's this little pocket, this little sinus, this little space. That's called the dural sinus. And the dural sinus contains venous blood. You got me? Can your skull expand on its own? Like, have you ever seen somebody's head just go? So watch. If somebody takes a bat and whaps you in the head with it, you can actually rupture that dura, and because there's venous blood in there, the blood can't spurtlate out, so it will begin to bleed into your skull, and it will begin to compress your brain. That's called a subdural hematoma. And the treatment for subdural hematoma is to take a Black & Decker drill into the skull, and let the blood spurtlate out. And if the brain is swollen due to head trauma, what they will actually do is they will cut out a piece of the skull and allow the brain to swell outside of the cranium, so it doesn't swell inward, compress off blood vessels, and you end up dying. It's called a cranial window. Do you remember that dude? Who are the dudes with the white tigers in Las Vegas? When dude got attacked by it, right? And his tiger mauled him. Now wait a minute. They're called wild animals. You know, I love these brain surgeons that get like a pet python, and then you hear on the news, yeah, Billy Bob there, he got crushed and then eaten by his pet python. Anybody have exotic pets? Do you, Randy? If I find out, I'm marking your whole life wrong. My sister dated a guy who had a pet tarantula. What is it gonna do? Let's go for a walk, dear Fred. So he had it in a fish tank, had a board over it and a brick. Anyways, my human turd nephew, of course, he took the brick off, and then the tarantula pushed up the board, and then it was in the house someplace. So my sister wouldn't go in the house. I don't blame her, right? So they made my nephews go in there and find it. They put it in a paper bag, and then my sister ran it over with her truck. And the guy she was dating, you ever see the movie Gremlins? He looked like a gremlin. I'm not even kidding. He had teeth going all over the place, man. A gremlin. Yeah, that's probably not good to look like a gremlin. Okay, here we go. Guys, watch. You're going to get this, and this is important. If you don't, just pretend like, look, for 25 more minutes, then you can ambulate home, all right? 25 more minutes, you can do this. Let me get through this. And act like you're paying attention, right? What I don't know won't hurt me. So if you're like, okay, watch. Watch. This is the dural sinus. What does the dural sinus contain? Venous blood. So remember that the dural sinus in the skull folds over on itself to form that dural sinus. Now, watch. The brain and spinal cord, again, don't have a lymphatic system. So the environment has to be tightly regulated. And what helps regulate the environment of the brain and spinal cord is the circulation of cerebral spinal fluid. Now watch. You have chambers in your brain. They're called you have chambers in your heart called ventricles. You have chambers in your brain called ventricles. You knew about that, right? Carl, you didn't know about that? Well, you probably won't remember it after this class. Watch. Ventricles are chambers, and they are fluid filled. What they're filled with, in this case, is not blood, but rather cerebral spinal fluid. And there are a specialized group of cells located in each ventricle. And there are 4 ventricles to the brain, which I will go over shortly. And this group of cells are called the choroid plexus. The choroid plexus filters blood plasma. It filters blood plasma. What color is blood plasma? It should be clear. So what color is normal cerebrospinal fluid? It's clear. So it's really the plasma of the blood minus the formed elements and albumin. So it has pretty much all the same constituents of normal plasma, electrolytes, glucose. Are you with me? And it's produced by each ventricle. And each ventricle contains a group of these cells that make up the choroid plexus. And basically all they are is a little filtering mechanism for the plasma. And the function of cerebrospinal fluid, CSF, can you see that? Yes. Is number 1, to provide buoyancy to the brain and spinal cord, to take basically the weight off, so allow it to float. Now, cerebrospinal fluid circulates. So what cerebrospinal fluid does is, number 2, is it allows communication between the blood and the brain. So cerebrospinal fluid makes up one part of the blood-brain barrier. Oh, well, why didn't somebody tell me? Yeah, well, look at all the words I wrote. Oh, it's too late. All right, watch. The other thing that it does, it allows the brain and spinal cord, how's this, better? The brain and spinal cord to remove some metabolic waste. So the cerebrospinal fluid is really kind of a way of keeping the blood and the brain separate. There's a lot of bad stuff that's in the blood, so what cerebrospinal fluid does is it filters the stuff that the brain and spinal cord need without having all the potential bad stuff in the blood.
So that fluid allows the brain and spinal cord to be separate? Or what did you say?
From the blood. So the
blood.
brain and spinal cord are separated from the blood by the cerebrospinal fluid. So, and then the other thing that it does is it cushions the brain and spinal cord. Now look. How many people have taken physics? Okay, don't worry about it. Watch. If you're driving in your car, let's imagine. I'm texting while I'm driving. Watch. If you're hit head on, the car is stopped, but you're not attached to the car. So the inertia will cause you to keep moving forward. Your brain is not attached to your skull, nor is your spinal cord. So when your gourd hits the windshield, your brain will continue to move, just like your body did when the car stopped moving. And that inertia will cause the brain to move and smash into the front of the skull, and then it will bobblehead like a Ryan Braun bobblehead down. It will bobble back and hit the back of your skull. So you get what's called contra-coup concussion. That's a concussion. A concussion is a bruising of the brain. It's literally damage to your brain. Tell me you got that. And if you get enough concussions, that can lead to early onset of Alzheimer's, Parkinson's, dementia. They used to call that with boxers being punchy. That's why there's a big deal in the NFL now that they have this concussion protocol. And here's why. Back in the day, Ray Nitschke, he was a monster. He was 6'3" and weighed 235 pounds. He's a beast. Ray Nitschke today, right, is a wide receiver. These guys are bigger and faster. And the faster you are and the bigger you are, the more energy you can create. That's why these guys are killing themselves, literally. All of these guys, especially quarterbacks, right, because they get blindsided, they're going downhill rapidly. And you can't, there's stories in it all the time where these athletes are killing themselves, and they're shooting themselves like in the chest to preserve their brain. So I'm not even kidding. You've heard of them? Dave Duerson, who was that linebacker for Junior Seau. Right, all these guys are offing themselves, and they're actually shooting themselves in the chest so that they can study their brain. But here's the thing, watch. Somebody says to you, you're 19 years old, we're going to pay you $10 million a year to play football, but you're probably going to die at the age of 50, and before that, 10 years before that, you're kind of going to be a vegetable. What do you say? Okay, let's go. Because when you're young, you think you're going to live forever. I would look in the mirror when I was 19, and I looked the next day, and I'm like, I still look good. I'm not aging at all. And then one day you wake up and like, hey, what the hell happened? And that's how they think. Now, bringing it back to something a little more that you can understand, this is how babies die. It's shaken baby syndrome. So if you take a child and you shake them back and forth, the brain does the bobbleheading, and what it can do is the brain stem can actually snap. Shaken baby syndrome, and I've seen it. And it's awful. It really is. It's just awful. I'm like, how do you do that? Like, how do you do that to a kid, right? People are weird. That's how it works. I had this one guy come in, and he was in a bar fight, and he clearly lost. And he was unconscious, right? His pupils were blown, right? They're real big, right? And I'm not going to get into this, but he went into a coma, right? And he was like posturing like this, and the ER doc said, look, we got to open up his skull. So we took a little razor tip saw, like a little Dremel saw, cut through the skull, and then his brain started swelling outside. It was just the weirdest thing to see. That was just weird. You want to see some weird stuff? Work in the ER. Okay, watch. Here we go. On average, the average adult produces between about 400 and 600 milliliters of cerebrospinal fluid per day. But at any given time, there's only about 150 milliliters circulating around the brain and spinal cord. So if you're producing 600 and only 150 circulating, what has to happen to the rest of that? It has to what? It has to be drained off. Tell me you got that. So watch. I want this whole thing. Ready? Here we go. Cerebrospinal fluid is produced in the choroid plexus, and it will circulate around the lateral ventricles. You have the lateral ventricle, and then you have the third ventricle here. Well, this is actually part of the third ventricle. And then connecting the third ventricle to the fourth ventricle is the cerebral aqueduct. An aqueduct is a little channel of water. In this case, it's cerebrospinal fluid. So it is lateral ventricle, third ventricle, cerebral aqueduct, and then you have the fourth ventricle right here. Now this is important. The fourth ventricle has a little hole in it called an aperture, right? In a camera, you have the aperture, the opening. So cerebral spinal fluid, once it goes through the cerebral aqueduct, it has two choices. It can go through the aperture of the fourth ventricle and circulate around the cerebellum, or it can go through the subarachnoid space and the central canal of the spinal cord. You learn this in, look, I'm not going to go over stuff that you had to learn. If you didn't learn it, then you're going to have to learn it now, because I just ain't got time for that. Watch. Here's the central canal. It's literally a hole that runs through the entire spinal cord, and that's where cerebral spinal fluid circulates. The remaining cerebral spinal fluid circulates in the subarachnoid space. Now I want this. So cerebral spinal fluid from the cerebral aqueduct can go through the aperture of the fourth ventricle and circulate around the cerebellum, and it goes through the central canal and then in the subarachnoid space of the spinal cord. This is very important, and clinically it's important. Cerebral spinal fluid circulates around the entire length of the spinal cord, including the cauda equina, or horse's tail. And then the cauda equina is embedded into the base of the coccyx, and it prevents the spinal cord from bobbling around. But cerebral spinal fluid circulates in the subarachnoid space all around the spinal cord. That cerebral spinal fluid circulating around the brain and spinal cord in the subarachnoid space, yes, makes its way around the spinal cord through the central canal and the subarachnoid space, and then moves back up. This is important. Moves back up and around the spinal cord, and then will circulate around the base and front of the brain and the back part of the brain. Are you with me? Now watch. What's this? What's this? What's this? What's this? What is that? What's this space? The dura makes it. What's the space called? The dural sinus. What's the dural sinus filled with? Venous blood. Watch. Look, you can see it right here. Indentations of the arachnoid mater, these little indentations indent into the dural sinus. Those little indentations are called, can you see that? Yep. Arachnoid villi. They are basically drains in the subarachnoid space. These drains in the subarachnoid space drain the excess cerebral spinal fluid and send it to the dural sinus. The dural sinus has venous blood, and the dural sinus connects it to the internal jugular, and the internal jugular to the brachiocephalic artery into the right atrium. So the function of the dural sinus is to have a connection between the cerebral spinal fluid and the venous blood. And because you are producing cerebral spinal fluid continually throughout the day, it has to be drained. And how it drains is through these little drains in the arachnoid mater called arachnoid villi. Yes or no? For real? That's good. Watch. sometimes everybody hurts. Sometimes kids are born or develop and there are decreased or absent arachnoid villi. Are the bones of a baby's skull fixed? No. The bones of the skull have connective tissue called fontanelles. And if those arachnoid villi are blocked or malformed, that baby will still produce cerebrospinal fluid, but it won't be able to adequately be drained. So that cerebrospinal fluid pressure will begin to build up, and it will cause the baby's head to expand because the bones aren't fixed, but it will also crush the brain, and they develop a condition called hydrocephalus. You've heard of this? So what do they do for these people? They have them go to Gateway and take advanced ANP. They put a shunt, a drain, into the ventricles of the brain. Then they put that tube underneath the skin of the skull, and then that tube drains into the abdominal cavity. It's called a ventricular shunt. This ventricular shunt actually has a pump on it. So you can pump your shunt. So if you ain't got nothing to do, what are you doing? Text them, pumping my shunt. I'm going to tell you a real quick story. Really quick. Probably so quick you won't even know what's happening. Guy I worked with at the company about 10 years ago. Got hired, salesman. I don't talk to him. I can't walk up to people and say, hey, you got problems. Right? They have to come to me. So he comes to me and he goes, Tim, I just want to let you know that I have a ventricular shunt. I have a congenitally narrow cerebral aqueduct, and about 6 years ago I had this shunt placed, on and on. I said, okay. Nothing happens. 3 or 4 years later, I'm talking to him. His eyes roll in the back of his head, and he passes out. So I say, call 911. And then the person says, what's the number? So everyone's gathering around waiting for the ambulance to ambulate him to the hospital. And so I'm on his head going like this, right? And the owner of the company looks at me and goes, Tim, what are you doing? And I go, I'm pumping his shunt. And I started pumping his shunt, and he woke up. Then he had to ambulate to the hospital because he had to get a new shunt placed. Sometimes protein debris can build up in those shunts. And the pump, by pumping it, provides a little bit of suction, and then can remove that blockage. But when they get a shunt in, when they place a shunt, your body's immune system looks at it and says, what the hell is that? And it will put a protein coat on it. So there are some people walking around with 3 or 4 shunts in their brain. Because you don't go in there and pull them out, right? You got to leave them in there, otherwise it's all kinds of problems. Yeah, that's too bad too. And he had a really nice head of hair too, so he had a bunch of and I'm like, you know, it should have happened to me. I'm bald, so who cares? You know, just life. Okay, hang on. Let me finish this. Watch. There's actually a little video I put together. You can thank me later. On the parts of the brain and the function of cerebrospinal fluid and how it circulates around the brain and spinal cord. Did a very good job with that. That was up against Rocky in 1976, and I lost. Who cares? I'm educated. All right. How many people here have ever had an epidural? When they give you an epidural, do they inject the anesthesia into your cerebrospinal fluid? I'll be the girl with the really big brain. Yes or no? Do they? Do you know? Well, I'm going to tell you. You got Christmas songs playing on there?
Pandora on your Christmas song.
Santa Claus is coming. Okay, you better, come on, get this. You gotta get this. Which is the dorsal and which is the ventral portion of the spinal cord? All right, come on, let's see if you got this. This is an easy one. That is going to be your whole final. I'm just going to point to it and you're going to tell me which one is which. Which is the ventral and which is the dorsal part of the spinal cord? Is it A or B? So I'm going to ask, which is the dorsal part of your spinal cord? A or B? You said that really fast and with a lot of confidence. That's really good. Don't you wish that would be your only final question? You would come in here, man, with your chest puffing out and like, hey, I got this, Timmy. Hey, watch. What does epi mean? Or outside, or above. So when they do an epidural, this is the dural lining, and then you have the epidural space. When they do an epidural, they're supposed to inject the medicine into the epidural space, and where they inject it below that, blood vessels will take it and anesthetize that area below the injection site. Tell me you got that. Are some teachers better than others? It's not the teacher, it's a student. Let's do another thing. That's not a good one. Are some doctors better than others?
Yeah.
Good. Are some anesthesiologists better than others? They are. So watch, I'm going to explain to you something. This. Uh-oh, that's secret. Wait, I'm going to show you something. Then you can ambulate home. Again, Timmy always gives you clinical reasons why it's important to know this stuff. Who cares? It doesn't matter. All the classes I treat the same, except the ones I don't like. Don't be packing up because you're not going to be paying attention to this, and this is going to come back and haunt you, and it's going to hurt my feelings too.
We're doing this. Not this. But you just said when you put a spot on.
Watch.
Oh, unless he went into that because he didn't. Did you do the circulation?
Yeah.
See, I didn't.
You're interrupting me. I'm going to show you something real cool. Watch. When people get an epidural, some anesthesiologists are better than others. When they put the epidural in, sometimes they will rupture the dura and then rupture the arachnoid mater. It's a very, very small distance. So if you put a hole in the arachnoid and dura mater, what's going to happen to the cerebral spinal fluid? It's going to leak out of that hole. Do you follow that? So after the epidural, after the procedure, the person sits up and then cerebral spinal fluid starts leaking out, so your brain starts resting on the base of your skull. So you get this really nasty headache. What did they tell you to do? They tell you to lay flat, don't they? They do. And if after a couple of hours, if the hole is still there, the next day, you know what they do? They draw 20 cc's of blood from you. They have to reinsert the spinal needle, and then they inject that blood, your own blood, into the epidural space. What does blood do when it's removed from your body? It clots, and it will form a blood patch, and over time it will form scar tissue and block that hole. So it's really a pain in the butt for people who have to go through it. So they have that big spinal needle in there. They pre-draw the blood. And then they start putting the blood in there. Now, this is also the bad part. They have to make sure that blood patch is successful. So they have to leave that needle in there with the syringe on it. And people have to walk around for a couple of years like that. And you just want to go up to them and just kind of go boing, boing. That's a blood patch. Tell me you followed that. So that's why you got to go to a good anesthesiologist. And you should always meet your anesthesiologist. Look at the thickness of their glasses, right? That will really kind of determine if they have good eyesight or not. All right, one last thing, and let me just do this, please. You know of anyone who's had a spinal tap? Who? Oh, you've had one? Where did they do it? What part of your back? Watch. Your true spinal cord ends at thoracic vertebrae number 1. So when they do, the rest of there are some spinal nerves, the cauda equina, yeah? And then the base of it lodges into the base of the coccyx. Are you following this? Now when they do a spinal tap, they actually have to put the needle into the subarachnoid space. You're following this, to get that sample out. So they want to limit the potential damage that they will do to the spinal cord. So they do it typically between L3 and L4, lumbar vertebrae 3 and 4. The reason they do it between those two vertebrae is to limit the potential damage to the spinal cord. But if you recall, and I made a point of saying this, that cerebral spinal fluid circulates around the entire spinal cord. How many people followed that? All right, you're itching to go. Go. On Tuesday, when we come back, I'm going to explain to you that why they have them lay on their side, right, when they do it, and they try to keep them as level as possible. And I'll explain that when we come back on Tuesday. I'm sure that you will not be able to wait. I'm assuming that many people will probably email me over, Tim, I can't wait. I couldn't sleep.